Good day. Today we'll be talking about tuberculosis. So globally, tuberculosis is one of the top 10 causes of death and leading causes from infectious diseases. During 2017, 10 million people developed TB worldwide, both men, women, and children alike. TB is a bacteria. This bacteria tends to proliferate in the lungs, but it can proliferate anywhere in the body: the brain, the spine, the gut, your stomach. So it can present as latent TB and active TB. In latent TB, the tuberculosis bacteria lives in your body but does not grow and proliferate. Therefore, you are unable to spread this disease from person to person. In active disease, the TB bacteria grows and proliferates. So in this disease, this stage of disease, you can definitely spread. So this is just a schematic of the way that this disease spreads. So it is an airborne disease, which means it spreads through the air droplets. So on top, you can see a lung filled with loads of little pockets of bacteria. So when this person coughs or spits or sings or shouts or sneezes, these pockets of bacteria are expelled into the air, and then a susceptible individual can inhale this bacteria. Not everyone that inhales the bacteria would develop the disease. That's where it comes in again, the latent TB and active TB. But those that develop the active TB, the ones that inhale them, the bacteria proliferates, and they themselves can expel the bacteria into the air, and then the whole cycle continues again. So signs and symptoms of TB depend on the location of the body that the bacteria grows. So the classic clinical features of pulmonary TB, that is TB that proliferates in the lung, that person would experience a persistent cough, which means that cough would probably last longer than 3 weeks. Then you have a production of mucus. This mucus can have odd colors, such as it can be yellow or green or even red due to the destruction of the vessels in the lungs, giving the sputum a red color. The individual may also complain of loss of appetite or a fever or sweats at night, and even weakness or fatigue. So to diagnose TB, TB of the lung or pulmonary TB, your doctor would probably do a chest x-ray. This chest x-ray would just look for changes in the lung that are associated with the disease. Then you can also take a sample of the mucus. Here you would just look under a microscope to look for any presence of the tuberculosis bacteria. If the disease proliferates outside of the lung, which is extrapulmonary tuberculosis, your doctor would most likely do a CT scan, an MRI scan, or ultrasound scan. These are just computerized pictures that can create an entire 3D kind of picture of your body, so that you can look for changes associated with TB again. Then we can do an endoscopy, which is just a long tube that you put down your throat with a little camera at the end, and you can look for changes associated with TB again. So high risk, there are some people that are at high risk for developing this disease. In particular, HIV positive individuals are 20 to 30 times more likely. Then we have any other group of individuals that are immunocompromised, which means their white blood cells or any of the cells that help fight infections are weak, so they aren't able to fight off this tuberculosis disease. So these sorts of people include the elderly, pregnant women, children, or even healthcare workers that are around so many sick individuals all day long. So the best way to prevent TB is to keep the immune system healthy and avoid exposure with individuals with active TB. Children living in a high-risk population should receive the BCG vaccine, which is a vaccine made of less a less potent strain of the vaccine that the vaccine that infects humans. These are usually from cows. The specimens are from cows. It's totally safe. But we tend to use antibiotics more than vaccines, though. We should periodically screen healthcare workers. Then all suspected individuals of TB should be isolated. They should be in a room for themselves. Anyone that's getting in contact with them should wear a mask because, again, this disease is airborne. And we should also treat latent TB with medications because we want to stop the progression of the latent TB into active TB if the person immune system gets weak. So to treat TB, you would want to give antibiotics, like I just said. So there's drug-responsive pulmonary TB and drug non-responsive. Drug-responsive, which means they react to the drugs, you would get 6 months of 4 different antibiotic drugs. Now, this may take several weeks before you start to feel better, but the exact length of time that you would have to take these antibiotic drugs will depend on your overall health and the severity of your TB. So it's important to keep taking your medication exactly as prescribed and to complete the whole course of antibiotics. Then, if you have extra pulmonary TB, like I said, TB that goes outside of the lung, then they tend to use the same combination of the 4 antibiotic drugs for 6 months. But if you have the TB growing in areas like your brain or your spinal cord, they would probably prescribe you, or most likely prescribe you with steroids. Yeah. So this is the end of my presentation on TB, and I hope you learned well. Thank you.